the choice of the home or the job, parent guidance, life, square, computer, multiple basically the choice of the or the best reputable parent guidance like square or fever and pneumonia, regular stay with the constructive and constructive Legal diseases like aspirin do not followed in drug has been the highest number of cure drugs and becoming paracetamol hygiene like antidepressant fever prescription aspirin. This is the original hospital which of the following drugs has the highest which of the following, which of the following, which of the following, the following max anti-inflammatory action is paracetamol acid, what is the chemical name of aspirin acid? Acetyl salicylic acid. Acetylsalicylic acid. Aspirin chemical name acetylsalicylic acid. Acetylsalicylic acid is one of the most widely used and prescribed analgesic. Aspirin is analgesic. Aspirin is analgesic. Aspirin एक आया है analgesic, antipyretic, intermediate, anticoagulant, iron depression. Aspirin एक analgesic है, antipyretic है, analgesic, antipyretic, anti-inflammatory, antiplatelet agents है, What according to the effect of aspirin do not include reduction of fever. Aspirin it is an analgesic आहे, antibiotic, anti-inflammatory, antiplatelet agent आहे. It prolonged BT है, prolonged BT है, prolonged BT करते. The effect of aspirin. The effect of aspirin do not include aspirin reduction of fever करते, reduction of prostaglandin synthesis in the inflamed tissue, anti-inflammatory है, impaired auto-regulatory of kidney function है, reduction of impaired auto म्हणजे auto regulation of kidney function है, reduction of bleeding tendency आहे. Aspirin will increase not reduce bleeding आहे. Which of the following is most common side effect of aspirin? Which of the following is most common side effect of aspirin आहे. Most common gastrointestinal bleeding आहे, urinary incontinence आहे, constipation, nystagmus आहे. A आहे gastrointestinal bleeding आहे, long term Long-term use of large dose of aspirin decreases synthesis of clotting factor in liver and prevent the platelet adhesions. So increase the bleeding chance like gastrointestinal and genitourinary bleeding cause pink urine आहे. ह्या ॲस्पिरिनने काय होतं, पिंक युरिन पण होतं. विच सिम्पटम्स ऑफ ॲस्पिरिन टॉक्सिसिटी should be the check the nurse first आहे. हायपरटेन्शन पिंक युरिन, डिझिनेस ड्रग पिंक युरिन होते. कशाने होते ते पण ॲस्पिरिनने पिंक युरिन होते. ॲस्पिरिनने वॉट आहे, ॲस्पिरिनने काय होते, पिंक युरिन होते. ॲस्पिरिन मुळे काय होते, पिंक युरिन होते. वॉट आहे देन डोस रिलेटेड ॲडव्हर्स वॉट आहे dose related adverse drug reaction. Dose related adverse drug reaction is called bizarre end of use failure. B is augmented dose related adverse drug reaction. Dose related dose related adverse drug reaction is called augmented आहे. The unpredicted effect of medication. Unpredicted effect of dose related adverse drug reaction is called augmented आहे. Then the unpredicted effect of medication in which a client overacts and underacts to a medication. It is termed as the unpredicted effect of medication in which a client overacts or underacts to a medication is termed isosynthetic allergic reaction. Side effect toxic is idiosyncratic reaction. It's called idiosyncratic reaction. It's called idiosyncratic reaction is unpredicted effect of medication overacts and underacts आहे. Genitally then terminated abnormal response. Genitally terminated not genetically terminated abnormal response to drug is called genetically determined abnormal response of drug is called a idiosyncrasy. It was genetically it called a idiosyncratic genetically determined abnormal response to a drug is called idiosyncrasy आहे. Then pharmacodynamics dynamics involve the study of following except biological and therapeutic effect of drug absorption and disturbance of drug mechanism of drug action and drug interaction आहे. It is absorption and distribution of drug आहे. Pharmacodynamics means what आहे, pharmacodynamics B. What आहे pharmacodynamics involve the study of following except आहे B आहे. Pharmacodynamics मध्ये काय होतं, pharmacodynamics involve the study of absorption and distribution of drug आहे. Pharmacodynamics and pharmacokinetic are the two branches of the pharmacology. Pharmacodynamic means what drug does the body आहे. The study of effect of drug on body आहे. It includes the physiological, therapeutic and biochemical effect of drug and their mechanism of action at the organ system and the cellular level. It gives emphasis on the dose of response relationship. It may have means a relationship between drug concentration and its effect आहे. Then pharmacokinetic means what body does to drug आहे. फार्माकोडायनॅमिक्स म्हणजे ड्रग टू द बॉडी आहे. कायनेटिक म्हणजे बॉडी डू विथ ड्रग्स आहे. इट इन्क्लूड द ऑब्झर्प्शन. ओके, Pharmacokinetic means of like absorption, distribution, biotransfer. बायोट्रान्सफॉर्मेशन म्हणजे मेटाबॉलिझम आहे, एक्सक्रेशन ऑफ द ड्रग. इट decrease time of course of consumption. What is the call to relationship between drug concentration and its effect? Called the relationship between the concentration, drug concentration and its effect. No. uh, Kinetics, dynamic, it is a B. Pharmacodynamics is B. What I pharmacodynamics? What is the call to relationship between the drug concentration and its effect? Concentration drugs, relation between the drugs and concentration of its pharmaco फार्मॅकोडायनॅमिक्स आहे. फार्मॅकोडायनॅमिक्स आहे. देन असतं आपल्याला काही then we have pharmacodynamics, a process by which a drug alters cell physio. Then what है B आहे, what B B process by which drug alters cell physiology is called B pharmacodynamic. Physiology Physiology process by which drug alters is called pharmacodynamics आहे. What is called to relationship between drug concentration and time. ड्रग कन्सन्ट्रेशन आणि टाईम म्हणजे फार्मॅकोकायनेसिस आहे. ड्रग इट्स इफेक्ट मीन्स डायनॅमिक आहे. and time it is pharmacokinetics आहे. Most drugs have a molecular weight between C आहे 100 ते 500. Most drugs have a molecular weight between C 100 ते 500 आहे. 180% of traded drug have 80% of traded drug have molecular weight under the 500 between 200 to 500 Dalton म्हणजे atmospheric unit. Smaller molecular weight is better because they easily diffusion आहे. Most drug have a molecular weight between 100 ते 500. 100 ते देणे वॉट आहे 100 ते 500. वॉट आहे 100 ते 500 आहे. वॉट आहे तर 100 ते 500 आहे. 100 ते 500 आहे. The rate of drug absorption is greater in the large intestine, gallbladder, small intestine मध्ये चांगलं observing surface area in the large and the small intestine due to the presence of villi and microvilli. The rate of drug absorption is greatest in the small intestine आहे. NSAIDs non-steroidal anti-inflammatory drug आहे. Non-steroidal what are non-steroidal non-steroidal anti-inflammatory drug आहे. NSAID non-steroidal anti-inflammatory drug used to relieve pain or tremor as a drug used to relieve pain or tremor as anesthetic आहे. Analgesic आहे. Then which of the following is the first line drug used for the pain management आहे. Ketamine आहे. Morphine is acetaminophen is PCM. PCM is what आहे. Acetaminophen is P आहे. Which of the following first line drug used for pain management is B. Acetaminophen आहे. Then classical substance that increase sensitivity of pain receptors by enhancing what a classical substance that increase sensitivity of pain. Classical substance that increase the sensitivity of pain receptors by enhancing the pain provoking effect of parenchyma. It is the prostaglandin. Prekinetic is the prostaglandin. Prostaglandins are the responsible for the pain. Prostaglandins are the responsible for the pain by the increasing sensitivity of pain receptor. No CCS by a mediator pain provoking substance like bradykinetic is product prostaglandin आहे. Then what is pharmacology? Yes, this is the pharmacology. Then a pharmacology in the institution of pharmacology, who called father of medicine आहे लुईस पाश्चर आहे. हिप्पोक्रेटिस आहे. Hippocrates are the Greek physician referred to the father of medicine because he was the first then held to attempt to record medical experiences for the reference a model called for the medical then parasitings promulgated by the Hippocrates called the Hippocratic Oath. What आहे हिपोक्रेटिक होता है who is known as Indian Hippocrates is urban जोका कैसे है Hippocrates है शुश्रुता is Indian Hippocrates है Shushruta constituted as a father of Indian medicine, also known as a father of Indian medicine and surgery का Shushruta. Okay, then Sushruta है. What is the sociological? What is the sociological definition of word drug आहे? Sociological definition of word drug आहे. A substance that changes mood, behavior or consciousness आहे. Dysfunction आहे, chemical आहे आणि etiology आहे. It is आहे. A substance that changes mood, behavior or consciousness आहे. What is the serological? What is the sociological definition of the drug? Drug means what is substance that change mood, behavior or consciousness आहे. त्याने consciousness आहे. Consciousness a name given to the drug by drug manufacturer. Name given to the drug by drug manufacturer. Official name आहे. Manufacturer name given by drug manufacturer. Chemical name आहे. Generic name आहे. Trade name आहे. is a trade name आहे. Trade name आहे. देणं आहे. Name given to the drug by the drug manufacturer is a trade name आहे. Three type of drug have three type of names आहे. Chemical name, chemical IUPAC name of drug आहे. Generic or non proprietary of official name. It is are usually more complicated and then harder to remember than brand names आहे. Trade name, brand or priority name आहे. It usually catchy because often related to the drug intested used to easy remember. For the Phenytoin is the generic name of the then Delentium is a brand name and same drug. Phenytoin is the generic name आहे आणि Delentium आहे. It is a brand name of the same drug. Then what type of nomenclature of drug are catchy and easy to remember. Catchy and generic and non-proprietary name आहे. C is proprietary name आहे. Proprietary name आहे. What type of nomenclature of drug are catchy and easy to remember is what आहे. is C आहे. proprietary name आहे. which आहे proprietary name आहे. proprietary name आहे. proprietary name which effect may lead to toxic reaction. Which effect may lead to toxic reaction when drug is taken continuously or rapidly आहे. Refraction tolerance, cumulative effect and tachyphylaxis is B आहे. then cumulative effect म्हणतात त्याला काय cumulative effect आहे. which effect may lead to Toxic reactions, which effect may be lead to toxic reactions when which effect may be lead to toxic reaction when the drug is taken continuously rapidly is cumulative reaction है देना cumulative effect of a drug means that the effect that cause toxic reaction after several doses have been given continuously or rapidly आहे प्रोग्रेसिव्ह डिक्रीज म्हणजे काय आहे डिक्रीज इन इफेक्टिवनेस ऑफ ड्रग आफ्टर द रिपीटेड यूज फॉर ड्रग टॉलरन्स और ड्रग इनसेन्सिटिव्हिटी आहे प्रोग्रेसिव्ह डिक्रीज आहे डिमिनिशन ड्रग टॉलरन्स डिमिनिशिंग आहे डिमिनिशिंग रिस्पॉन्स अ ड्रग आफ्टर रूटीन यूजेस कॉल्ड ट्रक्युफॅरेसिस आहे ट्रक्युफॅरेसिस आहे डिमिनिशिंग रिस्पॉन्स सब लोग कहाँ गए सब लोग किचन में क्या पढ़ रही है मेडिसिन नर्सिंग ड्रग्स 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 मतलब दवाई ड्रग्स सप्लाई करती हो क्या कुछ नहीं करती अरे बाबा भूख लगी यार खाते खाते उफ इतना सा decrease the diminution responsiveness to a drug after routine usage called drugstami the refractoriness means what है refractoriness means resistance to ordinary treatment आहे then what tolerance and drug resistance tolerance and drug resistance can be the consequence of drug dependent increase in metabolic degradation dependent on drug reaction act is b increase metabolic degradation आहे tolerance according to the increase in the level of enzyme that cause a degradation or metabolism of the drug that is the CYP 450 enzyme involved in the metabolism of the drug. It also be caused by the increased excretion of a drug due to the chronic use. Then what unwanted but unavoidable unwanted but unavoidable pharmacodynamic effect of a drug at the therapeutic dose is known as a side effect आहे unwanted but unavoidable pharmacodynamic effect of a drug at the therapeutic dose is known as side effects आहे ARDS what ADRS adverse drug reaction adverse drug reaction untreated harmful and unpleasant reaction of a medication at the therapeutic dose is classified into type 1 reaction. It sometimes referred to the augmented reaction which is dose dependent and predictable on the basis of the pharmacology of the drug. Type of B reaction it are bizarre, peculiar and individualized reaction which are the not predictable on the basis of the pharmacology.